Hi guys, my name's Andrea.
And I'm Verena.
I'm Daniel.
And this is our handover video for our Health and Community project.
So our group was working with the Peel HIV/AIDS Network, also known as PHAN, and they're a large organization that runs several programs, including services for those living with HIV, harm reduction services, services for African, Caribbean, and Black people, 2S LGBTQ+ programs, as well as women's health and services for sex workers. And so we chose to work specifically with the harm reduction program because of recent difficulties that the organization had with securing a safe injection site in Mississauga for IV drug users. And the harm reduction program aims to reduce the adverse health, social, and economic consequences of risky behaviors such as substance abuse from a non-judgmental point of view. And so we met several times with the Peel Drug Users Advisory Panel, which is a group of community members that advocate for this community. And our goal for this project was to figure out how physicians could better provide healthcare to those who use substances.
So our first step was to think of how we would carry out such a project and how we would kind of link healthcare providers to this community. So we decided that we would make an intake form for physicians to use when they're either receiving new patients or seeing patients in the ER. So we brought this idea up to the Drug Users Advisory Panel and they loved it. And then it became time to brainstorm what kind of questions we would ask in this form. And ultimately we came up with this form that I'm going to try to insert here in this video. Here are some of the key points that came up that they wanted to be addressed in this intake form. They wanted the physician to make sure that the patients felt comfortable asking these questions before they just jumped in and asked them, do you use drugs? How long have you been using drugs? So that was something important to start off with. Then they wanted confidentiality to be established. And then it was really important for the physicians to listen to what the presenting complaint was in this encounter and not to just focus on drug use if the patient was coming in with a broken ankle or mental health complaints. Kindness and knowledge on what users are going through, so the education piece, that's really important. Treating all patients equally, being aware of your facial expression and demeanor, the importance of exploring mental health status, and how can we develop a questionnaire that kind of addresses the fears and anxieties that patients are having. So ultimately, they believed that it would be really important for physicians to ask these questions in a non-condescending way. And they emphasized that if people are kind to them and treat them like anybody else, that they would feel more comfortable answering these questions. So these were kind of the important key points that came up in our meetings with the drug users panel.
At this point, we've created an 8-point questionnaire to help healthcare providers in discussing patients' IV drug use, as well as any comorbid psychiatric conditions or trauma that may be contributing to further use, as well as a means to build empathy between the healthcare provider and the patient. So the next steps that we're really hoping that the following group could pursue would include consulting once more with another healthcare provider, as well as the one that we've already been in consultation with. So the Peel Drug Advisory Panel all had glowing recommendations for a Dr. Murray, who's a family physician that specializes in working with addictions. And he's already given us some feedback before we actually created the form and then went to meet with the advisory panel. So now having met with the advisory panel and having a semi-completed beta project or beta form, having that then brought back to Dr. Murray to get his feedback, we feel would be very helpful, in addition to discussing with physicians who work in other contexts, so perhaps an ER doc. The other thing that we were really hoping that the following group could continue working on is the development of educational materials to accompany this tool. This way, physicians can feel more comfortable in interacting with this patient population in a way that's sensitive, but also in a way that demonstrates confidence and allows patients to feel comfortable divulging this sensitive information. In addition, we'd also like the group to work on looking at finding buy-in from other family physicians as well as physicians from other contexts. So, for example, ER docs.